So, welcome to the RMS Experience, where we highlight the dedicated professionals behind our remote medical staff. In this series, we explore the essential roles of our RMS team and what roles they play in healthcare. Today, we're excited to have Dr. Silvi Kerr with us to share her experience working as an administrative lead. Sylvie, thank you so much for joining us.
You're welcome. It's good to be here.
Yeah, so how are you today?
Everything good, everything good.
That's great. So, to start, can you tell us a little bit about yourself and where you're from?
Yes, sure. My name is Silvi Kerr. I'm a medical doctor, graduated with honors from the University of Buenos Aires in Argentina. I currently live in Córdoba and mountain area in the center of the country. I did my residency as an internist at the Belgrano Hospital in Buenos Aires. And I'm now working as one of the leads at the MSK MSO, in charge of one of the practices we serve, which is Digestive Disease Associates. And I've worked at several different roles, so it's good to be here.
So thank you so much for letting us get to know you a little bit. And Argentina is such a beautiful country. I actually want to visit there someday. So
You're
one of
welcome to come visit.
yeah, that's great. So one of the amazing things about the RMS is our global team, right? We have team members from different countries all around the world, which allows us to provide 24/7 support to the practices we work with. And for you, how do you think this global collaboration enhances patient care?
Well, we live in a global world, and lately we can tell that, well, we serve right now many practices in San Diego, and we have many Spanish-speaking patients there. Being from Argentina, I can help with those kinds of patients. But then we have also RMSs who can interpret in different languages. We have some RMSs from Arabic-speaking countries who can also provide help for those kinds of patients, the same as other different places in the world. So I think collaboration in terms of language and also in terms of culture is always a helpful and needed resource in medical practices nowadays.
Yes, I agree. So it really does help a lot of practices to have a global team. And
Mm.
let's get into your role as as an administrative lead a little bit. So, how long have you been working as an RMS, and what led you to this role?
Okay, I've been working as an RMS for almost 2 years now. I began in March of 2023. Um, I must say I'm one of the oldest RMS in age, and I have decided to become a remote medical staff because I worked as a family doctor for many years when I was in Buenos Aires. I have a large family. I have 5 children, and I've
Mm.
homeschooled most of them. I have now a married daughter and two graduated sons and daughters, but I still have a small little 8-year-old in my care and a 15-year-old. So I wanted something from my home, which would not take a full-time job. And I thought this would be a great idea, and it has been. So nowadays, the work as an RMS has been much better than what I thought. I've learned a lot of things along the way, and I can tell that the experience is very, very varied. Um, and I'll let you know a little bit more about it as you ask questions.
Yeah. So it's amazing to hear how your experiences led you to this role and how you've grown within RMS. And yeah, I must say, since I was also homeschooled back then when I was a teenager, it really helps with the family bonding when your parents work from home and you're also homeschooled. So that's great to hear.
Mhm.
And can you explain what your role as an administrative lead involves? Like, what are your key responsibilities?
Okay. So nowadays I am supervising the call center for the Digestive Disease Associates practice. That's a busy gastroenterology practice. There are four gastroenterologists working there together with two nurse practitioners, and it's a very busy time there. We pick up phone calls and we schedule patients for consultations, follow-ups, and procedures. And we have a very intense communication between the different people who work at the practice to get the patients in an adequate treatment, both for diagnosis and treatment of those types of patients. I also have worked as an RMS. I began at San Diego Neurosurgery, where
Mm.
I worked first in clinic, and I can tell that there's a very varied amount of things that you do there, not only in picking up phone calls, but also in doing proofreading of the doctors and the nurse practitioner's notes and taking care of translating simultaneously visits in Spanish. All these practices have a very big amount of patients who come from Mexico, since San Diego is so close to the border. So there are many Spanish-speaking patients which need translation during the consultations, and that's one of the other things that we did. And then basically whatever is required, you learn on the go, but you can do administrative tasks that have to do with prior authorizations and scheduling a patient to very clinical kind of things like following up with a patient, explaining treatments, sending in medication, or very different varied types of things. I also had the chance to work in surgery department, which was super interesting, getting patients scheduled for surgery at different hospitals there in San Diego. That was a very enriching experience. Also following up with their symptoms, working with the different research projects that the practice had or has, better said. We also did help with the operating reports, everything in a very tight communication with doctors and all of the people involved in a surgery procedure as complex as a neurosurgery. And I also got the chance, lastly but not least, to work in the educational department. That was an interesting experience as well, because we got to interview candidates who are applying for internships. Those are medical students in the US and in the world. We got to interview people from Germany and different countries, and that was very, very interesting. So I would say that the remote medical staff profile or work opportunities is very broad, and there are many opportunities to learn, both technology-wise, uh, medically wise, and in everything that has to do with health, both in treating patients and getting people ready to be doctors in the future. So I have found it to be more interesting than what I thought.
Yeah, that's really great. Thank you for sharing that. It's really impressive. And the experiences you had from the very first time you joined the RMS to now, it really shows or highlights how the RMS team consists of very qualified professionals with their own backgrounds, strong backgrounds. And one of the key things that ensure the quality of our work, I wanted to share this with the audience as well, is that all of us go through the HIPAA awareness for healthcare providers course, right? And we all are certified. So this helps maintain the highest standards of privacy and compliance in everything we do. So it's to
That's
ensure
right.
that both, yeah, patients and healthcare providers receive secure and efficient support. So let's do a little day in the life of your role as an administrative lead. Can you walk us through a typical day of yours and what does your schedule look like?
Okay, it has varied in time. I have been working here for over a couple of years, so I have had the possibility to have um, flexibility. Nowadays, I work from Monday to Friday on a 5-hour shift, usually in the morning from in San Diego time from 8 a.m. to 1 p.m. But that may vary, and this is one of the things that working in a team group has as a benefit it's that as long as you have coworkers who can cover for you, who know your role, who can do your work, it allows for flexibility. So nowadays, on a typical day, I work 5 hours a day, but I used to work 4 hours a day. And nowadays, I work in the morning, but I've also had evening um, timetables. At times, I work during the weekends. So I would say that a typical day for me now is quite stable, but it may also be varied and change, and the work will allow for flexibility.
Okay, so thank you for letting us, giving us a sneak peek through your day. And do you face any challenges in your role right now? And if you do, how do you overcome them?
Well, there are many, many challenges. And in our work. Mostly it has to do with excelling at solving patients' problems. I think patients have the main problem which they have, which is that they have to recover, regain their health in most cases. Some cases they come to the practice just for prevention, especially now in the GI practice. Many patients come for like cancer colon screening. So they're basically healthy patients who are seeking to maintain their health. But the patients usually come when they're sick, so they have already one problem. We want to avoid them a second problem, which may have to do with problems in how to access solving their main problem, which is the illness that brings them to the practice. So I would say that what we have to go and solve is every issue that may complicate patients access to doctors, to treatment, to procedures they need done. And we do this by working, I think, as a team and collaborating with one another, keeping a very, very communicative practice where patient calls for a problem and that problem gets solved as soon as possible with everybody avoiding things falling through the cracks and delaying the healing process for the patient. So, so I would say that that is the main issue we work on every day.
Yeah, it's great to see how much effort goes into keeping everything organized and running efficiently for your. So thank you so much for sharing that. I'm sure that we'll keep that in mind. And thank you for letting us see a glimpse into your day-to-day life as an administrative lead. So I'd also like to discuss with you what you think the role and impact of the MSO RMS is, since we play a crucial role in keeping healthcare practices running efficiently. So again, what do you think are the biggest benefits of having an RMS team?
Okay. The practices at the United States are complex. They require a lot of things done before the patient gets to be seen by a doctor. So the first thing I would say is that RMS can provide an optimized call center support. This was one of the greatest challenges by which we were hired by the Digestive Disease Associates. They used to have this big problem of not getting calls answered, and that seems something very simple, but at the same time, it is the start point for a patient to reach his provider to get, just call a number they gave them and have somebody answer that call. So we have had two, only two people added to that practice, and we have solved this problem completely for them, which is a lot to say. We pick up many, many calls, and we keep constant communication through different channels. It's amazing how being in different parts of the world through technology nowadays allows us, in spite of the distance, to keep us very, very close-knitted communication. And so we not only pick up the call volumes, high call volumes efficiently, but we reduce waiting time, we improve the patient satisfaction. Patients are no longer complaining about not being answered or having their problems not solved. And we also register those calls, which is also important, not to lose things on the go. We register every call we take using the different electronic medical records that the practices have. In this case, they use Epic, but there are many other electronic medical records where we can register the phone calls. We also improve documentation and record management, not just of our phone calls, but also of the patient's records, whatever that may be, imaging, referrals, I don't know, medical records from other practices. Okay, so we try to be as organized as possible to help practices have everything the patient has done and spoken with, and everything that has gone through the patient's life documented in their medical record system. We also work at different practices with the eligibility and authorization processing, making sure that every patient that is seen can that the practice can collect for that visit, for that procedure, or even that surgery when done. And we also help enhance care coordination. One of the main things that we feel patients need is confidence, not just in the provider who will be giving them healthcare, but also in their system. And I have an anecdote here, but I remember one time we picked up a call from a patient who really said this in his own words. And he said that for him it was as important to trust the neurosurgeon in his surgery as to trust his team to make sure that none of the things that he required to be healed would be lost in the way. So even though sometimes what we do may seem technic or may seem um, little insignificance, um, if it ensures a high quality medical service and very caring, um, compassionate care for the patient, and also a solution to the patient's problems, we believe it's important. And what else? We also try as best as we can to continually educate ourselves, get to learn more and more how to do it better. We try to do performance improvement, and for this, all our MS teams try to make sure that we can know how many patients we're seeing, know how the billing is going, how the notes are going, and we have different ways of measuring our work to make sure that we are growing constantly. There are
Yeah,
many
so
other things that may be done, but these are some of the ones that consider.
yeah, that's true. So there are a lot of benefits just from what you said, right? A lot of benefits that the RMS that having an RMS team would have for practices like improved workflow, and you said reduced administrative burdens on doctors and enhanced patient support. So, do you have, can you share with us a specific example of when a time your role made a big impact on the practice or the RMS team?
Well, I'm thinking for this practice that we're now working, I think just picking up a phone call and having patient be, just content and happy that and thankful that not only the provider is giving them a good service, but the whole office and the whole practice is serving them well has been very satisfying. I remember the change from when we began and having angry patients. Oh, finally you picked up the call. Nobody was answering. I called 1,000 times, and now they just get to know you. They know who you are. They know you're reliable, and so communication with patients and making patients feel happy and well attended is something that has been satisfying in this last practice I'm working at. I would have to say here as well that one of the advantages that the MSK, MSO RMS have is that they have many RMS that work directly with patients who are doctors themselves. So that provides, we don't work as doctors in the United States. We don't treat the patients, but we know how to do it in our own countries, and we know how to provide, just we have had the experience, many of the RMS working in different places, like dealing with patients and speaking with them, and just the understanding and the knowledge. I think it gives them confidence that you can explain things to them well, and that they can be listened to and evacuate their doubts. And I think we can help out without giving treatment or intervening as a doctor, because we don't have a license to work in the United States. Um, we don't do the work of a doctor, but we can give them a very good understanding and a clear contention. It's like patients, I feel they feel confident in us as RMS. And I think that's something that other remote medical or services, not having doctors working for them, maybe that is not always the case.
Yeah, I agree. It is a great thing. I also agree that most of the RMS are doctors, so that when patients call, they can be at ease that the person they're speaking with knows what they're saying and knows their condition. So it's an incredible example. Thank you for sharing that example as well of how impactful the RMS role is. And even in the small details, right? Just picking up a phone call could mean so much. And it really highlights for you how strong leadership and efficient processes can make a huge difference as well. So
Mhm.
thank you so much for sharing your insights and your expertise with us, Sylvie. And I'm sure the audience would love to hear advice from you. So what advice would you give to someone who wants to be a remote medical staff?
Okay, I would suggest, first of all, seek out and reach out to our team. Okay, get connected, be proactive, be eager to learn. We have ample opportunities for you to grow. There are many different ways in which you can serve as an RMS. Do not think that there's only one way. In fact, you're working as an RMS, maybe not so much in the medical field, but in the
Mm,
social media area. And so I think that do not belittle the role. Even if you're a doctor, there are many challenging ways in which to serve others, and also to have a very flexible remote work. Even as we have many young RMS, I think that I am of the older aged, but we have many people who are finishing. Just finished and graduated from medical school and preparing to either um, uh, enter into residency or planning their future. And it's a very good job to get an insight of what the medical world looks like. And especially nowadays, where so much of the medical world goes through the computer. So being able to work alongside, see the back, the like the backstage of everything that goes on an office practice is super interesting and very helpful to learn, even when these young doctors eventually have their own practices, they will have learned a lot of valuable stuff.
that is true. Even working on the social media team, I have also learned a lot in compared to the first month that I worked with MSO. I've learned so much, even in the medical field, even though I'm not in that field. But it really helps being in the RMS team. And like you said, the skills that you mentioned, I agree that those are really essential skills that all RMS should have. And what about for practices? Do you have something to say? How can healthcare providers maximize their support, the support that they receive from RMS?
Sure. I would suggest that the first thing that a medical practice needs to succeed in connecting with the RMS is a very high standard of communication. This can be provided in many ways. Usually, we communicate either via Teams, or different practices have different phone systems that work. But we have phone calls, text messages. Most electronic medical record systems have ways of communicating live there. And well, of course, via email and many other resources that are available. I would also say that it is important to establish clear response time expectations, but basically being available on both ways, making sure that everybody has been answered, whatever question they had. We also think that having clearly defined roles and responsibility, just the medical staff knowing what to expect from their RMS, and that may vary at different practices. Some practices just need remote medical staff who works with eligibility and authorizations. Others need medical staff or remote medical staff who work with billing department. Others need patient care through phone calls and follow up. Others need RMS who help in the research department. But I think it's important that the tasks are clear and expectations are met both sides. I think that also it helps to have regular performance reviews and feedback, as we were saying earlier, just weekly or monthly check-ins. We do this, for instance, at the GI practice nowadays. Every Friday we do a checkup of how phone calls have been answered. We establish the schedule for the following week, so forth. Of course, a collaborative culture. It's super important that we collaborate, not just the RMS. I mean, most practices have a lot of local staff working there. I can tell you, SDN has the interns, the leads working, the providers, and so do most of the practices. So the RMS working together with the local staff and the providers um, makes a successful team. And we were also speaking about training and continuous education. Most practices are also learning and training and growing. They're using new resources. They're checking and verifying what works, what doesn't work. So an RMS needs to keep updated and needs to be taught by the practice he works at. And also, it helps to have initiative to self-learn. When you see that there's a problem ahead, try and find ways to solve that problem. Um, and the last thing that I would say is, well, in this training issue, I forgot to mention, but it's important to have virtual team building activities sometimes. We gather as our MS team here at the MSK MSO frequently, both the leads and the whole team. Sometimes we share experiences of the different practices we serve at, and all of those things enrichen and make for us to grow and better serve the practices that hire us. And the last thing I would suggest is always keep in mind the secure and compliant technology things that we use. We are all very aware of to be HIPAA compliant. We also use the VPNs and two-factor authentication. You're after us to make sure that that happens as well. Just make sure that our patients' information are well kept and safe, and that there are no leaks there. Also helps to provide a good relationship with the practices we serve.
Yeah, so thank you so much for letting the audience know everything about RMS. This is such like perfect interview for the first episode since we've learned so much about the RMS and your roles. And it's been such a pleasure speaking with you today. So before we wrap up, do you have any final thoughts or messages for our listeners?
Well, I would suggest to get in touch with us. I would suggest to get in touch with us. Keep connected, keep learning, and keep growing. And we're willing to help those who are interested in working for the RMS team to join us. And we're also willing to make ourselves useful to those doctors in the US who need doctors from other countries of the world to better help them serve their patients well, reach out to patients who have a different culture from the American culture. And we have RMSs from the Latin American world, but we have also people from other cultures available to help your practices. So don't doubt to reach out to us, and we will try to better serve you the best we can.
Okay, thank you again, Sylvie, for all those insights and experiences that you've shared. It's really a pleasure to have you here today.
Okay, thank you, Yana. The same for you. Have a good day.
Thank you. You too.
So, before we end, I want to remind everyone that this is just the beginning of the RMS Experience series. We'll be featuring more RMS team members in the future episodes, so I hope you stay tuned. And that's a wrap on today's episode of the RMS Experience. If you've enjoyed this conversation, make sure to subscribe and follow our socials for more insights from our incredible RMS team. Thank you for tuning in, and we'll see you next time.